Cases involving pathogens like rhinovirus and human metapneumovirus are on the rise in China. According to reports, the country is experiencing a new wave of respiratory infectious diseases during the winter season. According to global media reports, the country is experiencing a new wave of respiratory diseases where recent detections show an increasing trend of human metapneumovirus cases, particularly among individuals under 14 years. Human metapneumovirus (HMPV) is a respiratory virus which was first identified in 2001. It spreads moderately easily and mainly through respiratory droplets when an infected person coughs, sneezes or talks. It can also spread by touching surfaces or objects that have the virus on them. It is one of the most common causes of respiratory infections, especially in young children, the elderly and immunocompromised individuals. HMPV is related to respiratory syncytial virus (RSV) and is characterized by symptoms similar to those of common cold. Hence, the top symptoms of HMPV mirror those of the flu or common cold, such as fever, cough and runny nose. For people with weak immune systems, the infection can progress to bronchitis or pneumonia. So far, there is no specific vaccination or antiviral treatment for HMPV. One can only take preventive measures like washing hands and avoiding contact with infected individuals. The bigger question is HMPV another COVID-19 like scare in China? Experts suggest to wait and watch. While the reports and social media posts suggest that the virus is spreading rapidly, neither the Chinese government nor the World Health Organization has issued an official warning or declared an emergency. However, what we have known so far tells us that the rise in cases is impacting children and the elderly the most, which means people who have weak or compromised immunity are at risk. But this can also be a seasonal phenomena due to winters. Young children have underdeveloped immune systems which put them at risk, while elderly or individuals with conditions such as asthma, cancer, diabetes or hypertension can also face severe complications. Now, is this virus in China a risk for India too? The Indian government is closely monitoring the situation. The National Center for Disease Control (NCDC) under the Union Health Ministry is closely monitoring respiratory and seasonal influenza cases in the country. HMPV has been frequently detected in India during the season of respiratory or flu illnesses. Hence, it's not a new pathogen for scientists to understand. However, this outbreak in China suggests the need for increasing surveillance and checking the trend among the Indian population.
So we are going to discuss about how it affects Indian population. Currently, we don't have any record cases noted with human metapneumovirus. Human metapneumovirus is a similar virus like COVID. It spreads through sneezing, coughing from respiratory secretions of an ill patient. But one good thing is it is not a new virus. We know this virus since almost last 20-25 years. Hence, generally it causes a short duration illness lasting for 3 to 6 days. And actually it's not very complicated or a fatal virus. It doesn't cause that much of a increased complications or death rate unless the patient has a low immunity. So patients whose immunity is low, who are on multiple medications for cancer, or patients who are post-transplant, need to be careful. So these patients need to when they're going to the crowded places, they just need to wear mask and follow good hand hygiene. Other than that, for human metapneumovirus, there is no specific treatment, there is no specific vaccine. If the infection happens, general care. And if the infection is very severe, patient might need to get admitted. Very severe means if they are having breathing difficulty, if they are having high grade fever, then the patient definitely needs to get admitted and have medical care. for the breathing difficulty and if there is any low oxygen. Also, whether a lot of questions are getting raised about whether it will cause increased cases in India. So currently we don't have any increased cases of human metapneumovirus in India. Even if it happens, generally because a shorter incubation period and lesser complications as in previous episodes, we don't expect a panic situation right now.
So last few days we've heard about these cases of respiratory illnesses originating from China, and obviously whenever there's a respiratory illness originating from China, the world will look at it. This time it is said to be a mixture of multiple viruses and atypical bacteria such as mycobacteria, and the one virus whose name is getting propagated is the metapneumovirus. Now the human metapneumovirus is not something which is not heard of. It is not something new. It is one of the commonest causes of respiratory tract infections, especially in children. But majority of the times, thankfully, it only leads to a self-limiting upper respiratory tract infection, and it doesn't really involve the lungs. However, if the person is immunocompromised or if there are risk factors, then of course it can lead to a lower respiratory tract infection or a pneumonia-like illness. But that would be rare. Unfortunately, what is happening inside China, the real picture we do not know, but there is nothing to panic about, right? We just need to keep our guard high. We need to take the COVID precautions back again. We need to start wearing masks when we are out in public, sanitize your hands, and try to avoid public places as much as possible. So I know this is a feeling of deja vu, but I think this is what we need to do to keep safe. There is no need to panic as of now, but always better to be safe than sorry. Thank you.